Hello, hello, good afternoon, everyone. And probably should have signed on a few more minutes before so we could let some people come in and start directly at 12:30. But we're gonna give it some time, and maybe about 5 minutes. I'll wait for some more people to join us, and if not, we'll start.
Sounds good.
Sounds good? All right, awesome. So we are just giving it some time. In the meantime, I would like to thank everybody for joining us as you guys decide to come on in. If you do not follow us on Instagram, we are at Hartford Health Us on IG, and you can also follow us here on Facebook at Hartford Health Initiative. Yes. And this is Talk Tuesday. This is a little segment that we have created, we're piloting just to see how it works. We want to share information with the community to make sure that they know what resources are here and just to start a conversation with anyone who wants to join us. And I did send out some posts too that we're going live, so. Maybe our friends will join us. And we are here in the lovely Swift building that's located on 10 Love Lane in Hartford.
They just got $900,000 from the Community Investment Fund to build out one of their spaces that they wanted to have add a workforce development hub and daycare services.
Yeah.
So a number of different things are happening in Swift.
Yes, there are. See, look at that.
I know.
I just work here. I'm kidding. All right, so we won't wait out too long. I want to get us started and keep for time. You know, I like to be on schedule. So my name is Chinika Bailey-Perrier. I am the Senior Program Associate here one of the Senior Program Associates here at Hartford Health Initiative. And we are starting this segment called Talk Tuesday. Again, like I said, it's our way of getting in touch with the community so that the community can get in touch with us. And what we like to do is bring different individuals from programs or services that you may not know about, that you may not have knowledge about, and shed some light on what those services and programs are, and bring the people that provide those services and programs. So today we have Carolyn Alessi. She is the Regional Director of Community Health and Wellbeing at Trinity Health of New England. And so I'll have her reintroduce herself a little bit and share a little bit more about her role and what is it that she does.
Thank you, Shanika. Thank you for having me. So I am the Regional Director for Community Health and Wellbeing and the Curtis C. Robinson Center for Health Equity. We're located on Tower Avenue. And in my role as Regional Director, I'm really responsible for building out partnerships within the community, looking for opportunities to build capacity with our community-based organizations, and also working with our clinical team to ensure that our social care needs of our patients are met. So that's pretty much in a nutshell kind of what I do.
Yeah.
I am the voice and the eyes and ears of our community inside the hospital.
Awesome. Yeah, that is actually great. The voice, eyes, and ears.
Yes.
Yes.
Yeah.
And so, in your role as a community director, what are some services or underutilized services that Trinity Health of New England may provide that the community may not know about?
Yeah, you know, it's interesting. I think the community knows of some of our programs, but for the department that I lead, Community Health and Wellbeing, we're made up of community health workers, family advocates, and mental health clinicians that focus on trauma-informed therapy, because we know that community violence is very high within Hartford, and so many folks are having issues with trauma and mental health. Right. So we have a specialized team that deals with victims of violence. And within our portfolio of programs in community health and well-being, we're kind of like the social care arm of the hospital. We are the public health arm of the hospital. Not many hospitals have this dedicated department that focuses solely on the patient's social care needs, not because the hospital typically focuses on the medical needs.
Right.
But we know that our patients come in with housing insecurity, with food insecurity. Maybe they're not employed, they don't have insurance, and so our department really focuses on making sure that we have wraparound support services. So one of the programs that we run that many of the communities may be aware of because it's been around for a while is the Joan C. Dauber Food Pantry.
Yep.
What's unique about this food pantry is the first hospital-based food pantry, but also we, in the last 2 years, completely renovated the pantry to be a green pantry, meaning we now carry locally sourced produce,
Nice.
Organic dairy products and meat products, sometimes halal meat products, because some of our clients who are food insecure, have those types of dietary restrictions, and low sodium canned goods. And we made an intentional decision that we would distribute food to the community, but we were not going to distribute food to the community that was going to continue to harm their overall health and well-being, and allow them not to be able to manage the chronic conditions that they know they are living with.
Yes.
And just because you're getting food assistance from a food pantry doesn't mean that you should get the less than foods than other people. So we really strive to make sure that our clients get that quality of food, because that was one thing that was communicated as a pressing need in the community, is access to healthy food. So we have that available.
And what day is that? Do you know?
So we have the pantry open to the public on Mondays from 9 to 2 p.m. On Wednesdays we have 2 slots. It's from 9 to 12 and then 3 to 5.
Awesome.
And then on Thursday it's from 9 to 12. And then every third Saturday of the month we do have what we call Diaper Day, because we distribute diapers as well. And those are for new moms, new families who are diaper insecure, can't afford diapers. So we do distribute diapers once a month, and the food distribution is once a month.
Awesome. Yes.
And I'll tell you a little bit about the other programs we have.
I was going to say,
we also have
some more.
Yeah, we also have our ride program, because transportation has become a barrier for patients to be able to get to their primary care appointment, annual wellness appointments. So we do have a regional ride program through Lyft Concierge. We also have a family advocacy center that I mentioned deals with victims who have been impacted by violence, which would be sexual crimes. So we service adults and children, and the Family Advocacy Center offers their resources for free through federal funding. And we also have a new program that we're lifting up in 2024 in the summer. It's the Food is Medicine program, and this is because
food is medicine.
Food is medicine, and this is really specific to patients who are struggling with their type 2 diabetes, their hypertension, and congestive heart failure. We're also incorporating a community health worker wraparound support service, and then a community kitchen, teaching kitchen, to learn how to eat healthy. And so those are some of the programs that are under our umbrella. We also do a lot of work around systems change. So right now, if anyone's interested in joining our Transforming Communities initiative, which is led by our partner YWCA Hartford region, and this is around dealing with, we can provide so many direct services and programs in our community, but when the system is broken, if there's systemic racism that exists that doesn't allow for access, then we have to work upstream to fix that. So this group is really working towards that. And it's a 5-year initiative that Trinity Health has invested in. So we have an investment of $1.5 million over 5 years to do systems change work in our community. So many of our residents are involved in it, our community-based organizations, and so we're excited about that.
And you did mention a little bit earlier when we were talking off camera about another way communities can, people of the community can get involved, and that was the advisory board?
So we have a patient and family advisory council, and this is an opportunity for patients to be able to provide feedback to our leaders on some of the programs that maybe they're considering launching into the community. And what does that look like? Does it work? Is it meeting the need? So they have the voice at the table to be able to make those changes in our hospital. But then we also, they also look at our literature, they look at our programs to make sure that they're equitable and easily understood by our patients. And that is not a volunteer council, so anyone who'd be interested who has been a patient at St. Francis Hospital, Mount Sinai Hospital, we'd love for you to join the Patient Family Advisory Council.
Awesome. And so with the advisory council, you did say it is voluntary based. Is it a monthly thing? Is it a weekly thing? Do you know the setup of?
No, but they have information on our website under
Gotcha.
Patient and Family Advisory Council, but I think they're striving to meet once a month.
Awesome.
Yeah.
Okay. And so, so we talked about a little bit about the programs that you provide, a little bit of how the community can be involved and provide feedback, as well as the community, how to get involved, feedback, but there's also something that we wanted to share as far as like what are some other services as far as women, maternal health. I know we touched about the diaper bank, but also Trinity Health has programs, well not programs, but they have a midwifery staff that I don't think the community necessarily knows about. So if you want to speak to that a little bit.
If anyone is looking for, support as they go along in their pregnancy, we have the Family Birth Center, New Beginnings, that you can take a tour of and schedule a tour. We also have midwives on staff. And I don't think everyone knows this, but we now have 4 OBGYN labor and delivery doctors who are women of color. So I think that's really important to highlight and make sure folks know. So that is a service that we now provide. I know I personally used a midwife when I was receiving my second child, and it was a fabulous experience. And so I think that if anyone's considering any type of maternal services, St. Francis has a really great department.
Yeah, that's awesome. And so if we needed to kind of like share our experience, if we receive services from Trinity Health, how do we do that? Is there a way that a person that we can talk to, a door we can knock on?
Besides calling me?
Yeah, besides calling you. How do you do that?
Yeah, so, and I'll say this because I'm going to be very candid. I know many people in the community have had a really tough time with services through our hospital. Their experience hasn't been great. And we are receiving a lot of that feedback through, Google reviews, through patient experience surveys, and we are taking those complaints very seriously, those grievances very seriously. So in terms of if you're coming to our hospital and you are inpatient and you're experiencing a not great experience with staff, with services, you or your family can file a complaint through patient relations. So that's a grievance that you can go through patient relations. You can email them at patientrelations at Trinity Health in New England, trinityhealthofne.org. We have to acknowledge, according to regulatory authorities, within 1 week, acknowledge that we received the grievance, and then within 30 days, we will respond in writing with the results and the outcomes. So on the inside, what we do is we do a lot of due diligence. We look into what has happened with that patient from beginning of their entry into our hospital to the point of discharge, and we try to look at where we can provide more education to our staff, where we can fill gaps in services. One of the big opportunities we have is we're building up our community health worker workforce. People who are from our community who are now supporting our patients inpatient in the safety net clinics and in the community who understand the barriers and challenges. Okay. So we have that. And then also what we're doing proactively, and I'm a part of this, is we do leadership rounding with patients. And so if there's an immediate issue that has arisen that has really made the experience not optimal for a patient, we can right then and there rectify it very quickly. But we are proactively trying to make sure that our patients have the best experience in figuring out where those experiences that are not great are coming from.
Right.
And I am the voice of our community inside the leadership table. So I have community members that oftentimes will call me, or community-based organizations will call me and share with me the experience. And there was one, there are times where I will facilitate community conversation with our leadership and with community partners who have, members in their organization that have had really tough experiences. And I've done that with Mothers United Against Violence, where moms felt that they were not being treated well when their child was coming in for a gun-related injury or when they passed away. So we had a really deep, vulnerable community conversation around that with our leaders. So we're really trying hard to make sure that our patients are heard, we're listening, and we're trying to proactively put things in place, as well as intervening when something is not going well.
Yes, awesome. So yes, this is good. This is all good information, and I am going to ask one more guiding question, because this conversation is actually very informative, and I think there was a lot that we covered in just this short span of time. And so the last question that I wanted to ask was, what is the best way to contact you specifically, because you are the eyes and ears? What's the best way to contact you? Let's say if we just have a question about the services and programs that you just went over, or just how to get involved. What is the best way to contact you?
So you can contact me by email, Carolyn.Alessi, Alessi, at Trinity Health, OF as in Frank, NE.org. You can call me. My desk phone is 860-714-7292, or you can reach me by my cell phone, 908-938-5965. I want you to know that I'm easily accessible through those three methods, and I'll get back to you very, very quickly, if not same day, a few minutes.
Yes.
Yes.
Yeah. Because it's important that we can have a name and a face, right? When we are looking for advocates, and when we're learning on how to advocate for ourselves. So that is something that I really wanted everyone to know. I will pin that information in the comments below and when we repost. So I'm trying to think, is there anything else that you want to share?
I think that there are some opportunities for particularly our youth to get involved. We have a program called Let's Not Meet by Accident, and that program is run through our trauma department, and it's a very comprehensive program showing the youth what impact happens when you're using your phone driving under the influence. So they take you through the trauma bay. They take you in, you're sitting on a gurney. My daughter went through this and loved it. Mm-hmm. And they take you up to the helipad where the helicopter comes in for someone who's had to be extracted and flown into the hospital. So they go through this entire journey in hopes that we can prevent them from making some fatal mistakes as they're on the road, driving. And we also have our Stop the Bleed, which we train anyone on how to literally stop a bleed, putting a tourniquet on, stuffing the wound, so that if EMS is not arriving soon enough and you have someone that is either cut their finger, got a gunshot, got stabbed, any type of injury that's going to cause massive bleeding, you're now empowered to be able to stop that bleed.
So would this be like a first aid training?
Yes, similar to first aid.
Okay, awesome.
It is, yeah.
Do you get a certificate at the end of this?
You do get a certificate, and oftentimes we'll give you your own individual Stop the Bleed kit so that you have it and you put it in your purse, you put it in your car, you put it in your work bag, anywhere, so you have it on hand.
Awesome. And for the young adults, that program, what's the age group Is it,
So we go 16 and up,
Okay.
Just for safety reasons. And usually schools will facilitate a group coming in.
Got
So
it.
Weaver High has come in and participated in the Let's Not Meet by Accident, through their community partner Blue Hill Civic Association.
all who we all
Yeah, we
work
all
together,
know.
we all know Blue Hill Civic Association. And so, is there anything else that you wanted to share as far as Trinity Health of New England and what you do as a community director?
Yeah, so we also have a really great space on Tower Ave. We moved to a new location on 659 Tower Ave. And we have a living room space that we in-kind to community groups who maybe can't afford to rent
That's
space.
in kind, okay?
In kind,
Yeah.
and so we have, Community Action Task Force that uses it for their monthly meetings with their residents, and we also have Compass Youth that uses it for our conference room for peace builders and training peace builders in the community. So we're open doors, we really want to make sure that we have a space that we know is a challenge these days to find space to meet, let alone having to afford to pay for that renting of the space, so we can kind of. So I just want to make sure everyone knows that and is aware of that. And if you want to stop by and take a tour of any of our facilities, just reach out to me. I'm happy to, give you a tour.
Awesome, yes. Thank you so much for joining us today, because this was very, very good and informative. I enjoyed learning about Trinity Health of New England. I lived here for many, many years and did not know half of what was being offered through our healthcare system, right? And so I think it was also important for me to, sit here and get this knowledge, because if I didn't know it, think about how many other people that don't know about this, these services and the programs that are being offered. So this is the
mention one thing.
one more.
If you want to go and receive services, we do have an urgent care center that we opened on Cottage Grove in Bloomfield,
Okay.
and it's open until 8 o'clock in the evening. I've gone there personally because I injured myself, and I was in and out within 20 minutes. Saw the doctor, got an X-ray done, and had a prescription filled, and it was like the easiest process that I've gone through. So I would encourage you to visit the urgent care if you need those services.
Nice. And the question to just follow that up with, if you don't have insurance, is there a do they still take you if you don't have insurance? Is there a sliding scale? Like what? How?
Yeah, we don't refuse anyone.
Got it.
We don't.
Awesome. Okay. All right. Well, I'm going to keep for time. We are at 12:53. I don't want to go too long, but thank you again, Carolyn, for joining us.
Thank you for having me. This is great.
Yes, and I hope we can do this again.
Absolutely.
Hopefully we'll have some other people, some other organizations and different people wanting to join the conversation and share their services and programs with us.
That'd be great. Yeah.
Yes.
Thank
Okay.
you.
All right, we're logging off.